Tonight we're going to be talking about prostate and the prostate grabbers. I tried to think up a catchy title for tonight's talk. So with so many things in conventional medicine, when something goes wrong with it, conventional medicine looks at trying to remove it or burn it out or radiate it or, do something else with it, which removes some of the symptoms, removes the diagnosis for a while, but doesn't take care of the real cause. So we're going to talk more about causes tonight. I'm shocked at how many females are here tonight. I want to thank you for coming and supporting all your friends and family with prostates. And believe it or not, I'm going to be talking about female prostates. So something we don't hear much about, but hopefully it'll make your night worthwhile. Let's see. Do the right one. There we go. First of all, I just want to, for especially the new people that don't know me, I'd like to talk a little bit about how I see the medical world and how I approach things. For a lot of physicians, they typically say, okay, you have this diagnosis, then you get this product, you get this drug, or you get this herb or this supplement. And what I try to do, I try to figure out, okay, what functionally is going wrong? What's the original cause of this imbalance? So if I can support that, usually, there's a group of things that balance out along with that, and the person feels much, much better without a whole lot of medication and fuss. So one of the things I look at is balancing tissue pH. So that tells me a lot about the person's acid-alkaline balance, how their diet is affecting their health or maintaining their health, let's say. I look at how well their body is detoxifying. So if your body isn't able to discharge what waste products it's collecting, then it's going to run into trouble somewhere. So we have all these organs of elimination that we need to support: the colon and lungs, circulation, skin, liver, kidney. These are all really important in maintaining our health. Of course, you want to promote circulation. So with our various organ systems, if we don't use those organs, if we don't use those muscles, we're going to lose them. They're going to atrophy. And that's a lot of what happens with the prostate. And I'll explain more about that. Another way of optimizing health is by optimizing your hormones, because the hormones have such a dramatic effect on almost every cell in our body. So if we can keep our hormones in balance, even at age 90 or 100, you're going to do much better. Another thing I like to look at is balancing the anabolic and catabolic phases of our bodies. So normally we spend about 12 hours a day in anabolic, which is building up, and then 12 hours a day in catabolic, which is breaking down. So normally around 6 a.m. to 6 p.m., we're much more catabolic. We're using our muscles, we're active, we're doing things, we're burning up a lot of the nutrition that we built up, for the days prior. We're sweating, we're using these things up. So we need to balance that out with an anabolic process. So that means getting enough sleep, enough rest, good nutrition, good foods, minerals, amino acids. Those are what build us up, okay? And especially, we're going to be talking about prostate cancer a little bit, but for a lot of people, they don't die of prostate cancer. They die of cachexia, it's called, where you just get so malnourished and malnutrition sets in that you just waste away. So that's really what you want to avoid. And of course, another thing I like to do is honor the natural biorhythms that we all go through. And of course, these involve the hormones themselves. So if we can respect the normal biorhythm of the body, then we know when to intervene with various treatments. Okay. So let's talk about the prostate. In the middle, yes. Okay. So there's that little guy right there. So notice where this prostate is located. There's a lot of plumbing around there. There's a lot going on. One of the problems that happens as we age is all this up here. We carry all this weight, a lot of fat. You know, our intestinal tracts are full. It's not so much the bladder putting pressure on the prostate, it's everything else just kind of compressing it down with gravity. So, you know, the prostate gets easily squeezed in there, and, you know, there's no place for it to go, basically. So that's why circulation is so important through there, because you want to remove, it's like anything that's swollen, you want to remove the excess fluid out of there just by promoting circulation, okay? One thing we're going to talk about is Kegel exercises. Everybody familiar with that? So Kegels will exercise those muscles that form the pelvic floor in there. So it's like squeezing off urination. If you can squeeze that muscle over and over again several times a day, it basically lifts your whole pelvic, it strengthens that pelvic muscle to lift everything up and put everything in place. So I wanted to show you this other picture too. It's a similar shot, but here you can see when the prostate gets swollen, it really limits the amount of urine going through there. So, you know, when you're 20 years old, which it looks like this guy, you know, this pathway gets more and more squeezed off. So the prostate not only swells outside surrounding that area, but also on the inside, okay? And that's why sometimes people get intermittent symptoms of feeling to urinate, even though there's not a lot of urine in there. Does that make sense? By the way, this is going to be pretty informal tonight. If you have a question, you know, feel free to interrupt. I can. We are recording, but we can go ahead and answer questions. So here are some prostate fun facts. Prostate means protector in Greek, and I have no idea what that means. I'm wondering if, you know, because the prostate produces semen, that it protects the sperm somehow, but I'm guessing that. I'm not Greek. The other thing is a lot of men come in and say, well, I want you to help me with my prostate. And it's one of those things that it gets confusing, you know, you want help with prostate or prostate, or, so just a language thing there. So the prostate is pretty small. It's the size of a walnut, you know, and it creates all this havoc. Or a kiwi, you know, it's pretty tiny. It only weighs about an ounce and only about 1.5 inches long. So pretty amazing. And of course, it delivers a vehicle to deliver the sperm to the egg. So it's a very unique fluid, and something that is, well, let's talk about that a little bit more. Oh, before that, I want to mention women have something called a Skene gland, which is located in the anterior labia. And interestingly, these glands produce a lot of fluid to help during intercourse. And in 2002, the Federative International Committee on anatomical terminology, said, okay, let's change that gland, change the name to the female prostate. So it didn't seem to catch on too well. But officially, it's named the female prostate. And there's an article in the Seattle Times, I love that title, Gee, Women Have a Prostate. So, and what's really interesting is it creates just as much fluid as a man does during ejaculation. So, one of those fun facts. So what is the function of the prostate? Of course, prostatic fluid is about, 1/2 to 3/4 of the semen. Semen is very alkaline to counteract the acidity of the vaginal tissues. So, and that seems to protect the sperm. Prostatic fluid will have sugar and proteolytic enzymes to help with that whole process. And interestingly, it contains large amounts of zinc, up to 500 to 1,000 times what the serum levels are. So that's why zinc is so important to the prostate. It's one of the key nutrients here. And your body, a man's body will concentrate the zinc in the prostate fluid. And of course, the prostate needs testosterone to function properly. And it's actually the dihydrotestosterone that regulates the prostate function directly. Right, so the DHT, that dihydrotestosterone, which is the most potent testosterone, it actually causes the hair follicles on the head to miniaturize, so it doesn't grow hair as well. And that's why it gets kind of fine first and then just falls out altogether.
And then what's the next one, the BPH?
Oh, it contributes to benign prostatic enlargement. So in other words, that DHT can aggravate enlargement of the prostate. So one of the things that I like to measure on a 24-hour urine test is, okay, how much of that 5-alpha reductase enzyme are you making? And from that I can determine, okay, what do I need to use to inhibit that, assuming, he's coming in for a prostate problem, okay? So ways to suppress that enzyme. There's, of course, an approved drug called finasteride. There's also a topical Propecia that can be used to maintain your hair growth. But there's a lot of side effects here. And I have guys come in and they say, oh yeah, I'm using Propecia, just a little dab on the top of their, in their hair. But when I check their 5-alpha reductase levels, it's just slammed up against the low side of the scale. It's like almost zero enzyme, which can also be a problem. So, and that's why you get so many side effects, because men tend to be overdosed with this stuff. They get sexual dysfunction, erectile dysfunction, lower libido, even male breast cancer risk, and depression, memory loss, and brain fog. And another thing it's been linked to is if you do happen to get prostate cancer down the road and you've been taking this finasteride, it can create a more aggressive type of prostate cancer.
Is that the same thing as minoxidil?
I think so. Propecia, minoxidil, yeah. There's various 5-alpha reductase inhibitors, but they're all kind of doing the same thing, yeah. Well, it's approved for BPH, enlarged prostate, benign enlargement of the prostate, and also hair loss. So, yeah, or just take it orally. I can tell. Yeah.
Is borage oil a good preventative measure for men to take on just a normal basis every day?
Yes. Yes. So a good preventive measure is a little bit of zinc and borage oil. If it's a really big issue, then I'll go into the bigger guns, maybe saw palmetto and beta-sitosterol. We'll talk more about that later on. But these are the most potent things. I wish they worked a little bit stronger, but I far prefer them over the finasteride.
What about the other male enhancement performance things that are on the market there? You know,
For sexual function, you mean?
do they do would they be on that list too? Furious or whatever. I mean, some of those we can't even pronounce.
Well, they're testosterone promoters,
Yeah.
and yeah. Well, they could be helping for some guys, but a lot of times it boils down to the hormone balance, you know, and also how you're managing your testosterone. Because a lot of guys, you know, as we age, it goes right into estrogen,
Right.
you know. Or if you're a little bit insulin resistant, boy, it goes right into estrogen at that point. So that's one of the biggest things that happens to us is our testosterone either gets mismanaged by this enzyme or the aromatase turns it into estrogen.
So there's tests for that?
Yeah, we routinely test that. Okay, so true or false, testosterone causes prostate cancer. How many say true? False? Good. I was hoping you'd say that. So, yeah, I mean, testosterone does not cause prostate cancer. And I can't tell you how many guys come in and say, oh, my urologist said, you know, testosterone causes prostate cancer. I don't even want to go near it. And that's not the case. Otherwise, 20-year-olds who have a huge amount of testosterone would be in big trouble, right? It's really a combination of things. Now, if you already have prostate cancer, and you know you're dealing with that, you're working on that, and you add testosterone to it, testosterone is very anabolic, so it can aggravate prostate cancer that's already there. Okay. But even then, there's a great book called Testosterone for Life. Written by a Dr. Morgenthaler, and he talks about this issue at length and how the research has been totally misleading people for years. And a lot of it is based on one case back in the 50s, and they've just been projecting ever since. So great book if you'd like to read that. How about early male pattern baldness increases risk of prostate cancer? Not really. I mean, all that means is that particular gentleman has a high 5-alpha reductase. It's a pretty normal kind of thing. A lot of women have high 5-alpha reductase. For women, you know, if I give them testosterone or DHEA, and they have a really high enzyme, then they're more likely, they're more likely to grow a mustache or get acne or, you know, some male-like symptoms. So I like to test that, otherwise they'll swear at me and get mad.
Doesn't DHEA turn into estrogen type thing for guys too?
What does DHEA go? DHEA is actually right above testosterone. So for women who, of course, need a lot less testosterone, that DHEA can quickly give them enough testosterone to really help them.
But it would work the other way with men. Doesn't DHEA turn into
Yeah, DHEA can turn. No, not necessarily. I mean, the testosterone will turn into estrogen first. So DHEA if you look at the cascade.
If a guy took a bunch of DHEA, it could go to turn to testosterone testosterone, and then that testosterone could turn into estrogen?
Yes.
Oh, that's how that
Yeah.
works.
So DHEA doesn't directly go into estrogen. So, yeah, that is confusing. True or false? 1 in 10,000 men under 40 develop prostate cancer. That's true. Very, very few men under 40 get prostate cancer. How about exercise? Exercise doesn't necessarily help prostate cancer. Yes, it does. Yeah, that's false. So, and probably one of the best things, I don't know of many guys that'll do this, but if you do shoulder stands or stand on your head or do one of those inversion tables, you know, that probably helps the prostate quite a bit because it actually, you know, takes the pressure off, and the prostate has a chance to recoup and circulate a little bit more. Prostate enlargement occurs in half the men over 60. Yeah, that's true, and it's actually closer to 60%. So it's the 60% of men over 60 will have prostate enlargement. So really, really common.
What about one of those sensory deprivation chambers? Would that help too? Take the load off the prostate as well?
Oh, maybe, yeah. I'm not sure about that. So this was really interesting study. They found that men who ejaculated more times a month, in other words, it was over 21 times a month, they had 1/3 less incidence of prostate cancer. And I found that fascinating because it's an old naturopathic adage that, you know, the less you use it, then you're more likely to lose it. So, I'm sorry, the less you use, if you don't use it, you lose it, right? So men who tend to use their prostates more, again, you know, they eliminate whatever inflammatory products or toxins that might be in there. And there's also this myth that vasectomy can contribute to prostate cancer. And they did a really large study in China about this recently, and that was found to be false. The vasectomies do not contribute to any risk one way or the other. So, did everybody get a score sheet on how to score your prostate health? You don't necessarily have, yes. You don't necessarily have to fill that out now, but it's a pretty standardized list of symptoms that you can actually use to see how you're doing. And a lot of the research that I'll be citing tonight use this symptom sheet to really analyze men and how they're doing. So it should make sense to you once you look at those questions. Yes?
You mentioned that you can actually help the prostate if you do inversion table or you're upside down. And then you also mentioned earlier that the sphincter muscle.
The Kegel exercises are really good, yeah.
I'm wondering why, because it seems like it would actually push up against it.
Well, you're getting movement. Yeah, I think I understand your question. Why inverting or compressing? But you're actually getting in and out circulation around that area. So it's kind of a tight area, and it's hard to get, you know, circulation through there easily. There's a lot of pressure on that. You know, you've got the intestinal tract and you know, just fat tissue, and so makes sense. So what are the best ways of really looking at prostate function? I want to go through various things you may not have heard of. And we're going to talk a lot about PSA screening. Do we just ignore it, or how do we use that? So one of the things really, oh, here's a little joke here. A lot of my patients are reluctant to get their prostates checked. I didn't notice that little vise at the bottom there till later. We have those at the dispensary, by the way. Okay, so I don't know who thought of this study, but I just thought it was really fascinating that, you know, when you look at your pans for guys, they found that an index finger that was longer than the ring finger, there was less risk of developing prostate cancer. Okay? By 33%. And they feel like that's somehow related to how much testosterone you were exposed to in your mother's womb. So the more testosterone, I guess, you have, the longer your ring finger. Does that make sense? Yeah.
What meridian would that be from an acupuncture standpoint?
You know, that's a great question because the endocrine, I think it's the triple warmer goes through that, which controls well, this is the part of the endocrine system. So, yeah. So the longer, and for women, the longer index finger is also indicative of a higher breast cancer risk for women. And again, you know, I hate to say estrogen causes breast cancer. It's the same misconception that just like testosterone causes prostate cancer, it doesn't relate. But here's a guy with a longer ring finger, and this is associated with increased testosterone exposure in the womb and more risk of prostate cancer. They've also found that may link to osteoarthritis. And then we're all familiar with the digital rectal exam, which doesn't give the doctor that much information. I think it's more torture than anything. It does detect, you know, the hardness of the prostate. If there perhaps are some nodules there, that could be a problem. And then you can also feel a little groove, you know, between the lobes of the prostate. So that should be pretty symmetrical and pretty full, and the prostate should not be hard at all. But that, you know, that's about it. It misses any early stage prostate cancer, so it doesn't give a lot of information to anybody, even though it's still recommended. There's also something called a male PAP, which stands for prostatic acid phosphatase. So this doesn't seem to be used very much anymore, mainly because most urologists will strictly go by the biopsy. But this particular test is useful because it tells us whether the prostate cancer has spread to other organs. Okay, so it looks at more metastases. Levels greater than 3 would indicate something beyond the prostate itself. So let's talk about the PSA. And this is one of those things that's so confusing. I think even the urologists are really confused about it. They're told by the U.S. Preventive Services Task Force, don't bother testing PSA. And the reason is that prostate cancer is painless. So most men just go through life and they have it, and you know, it's no big deal. It doesn't disrupt their quality of life. So testing the PSA is too costly over the long run and doesn't necessarily save lives. Okay, so that's their reasoning, and it's strictly based on cost factor. And they also felt like the PSA was used too much in the past. You know, a man would do a routine PSA at their annual exam. It's a little bit high. The doctor doesn't know what to do, so they run right into a biopsy. You know, I mean, it's too aggressive at that point, and we'll talk about why that is. Does PSA have does it have a purpose? Well, it turns out, yes, it helps to keep the semen liquid. It helps the sperm swim freely. And it also dissolves cervical mucus to help with fertilization. So, I don't know who studies this stuff. And one of the arguments for testing for PSA, yes?
When you're on DHEA testosterone stuff, is
Okay.
PSA something you want to check periodically?
Yes.
If you're doing testosterone?
Yeah, so the question is, when you're using testosterone or DHEA, do you want to check PSA fairly often? And yes, that's true. And why is that? The testosterone could be contributing to DHT production, like we talked about, which can cause prostate aggravations, prostate inflammation. Okay. So we want to just keep an eye on it. And it doesn't necessarily mean that you're going to totally go off testosterone at that point, but it can be perhaps a little too stimulating. But they started using the PSA screening in 1994, 20 years ago. Excuse me. And you can see how useful it's been. The rate of prostate cancer deaths have been steadily going down. And that 2014 was just my projection. It hasn't been measured yet, but I imagine it's just getting better and better. And what a lot of doctors don't do, which I still don't know why, but there's a test called a percent free PSA compared to the total PSA. And it just gives you infinitely more information than just the total PSA.
Why are they so hesitant to do it? I found that out at the VA this past week. They did not want to do it.
Other than money, I just don't understand why. I mean, it costs more, but it's so much more informative.
Aren't they that way with most tests, though, like there's more sensitive
Yeah.
vitamin D tests?
Well, a lot of physicians, and especially government agencies, are, they're following the Medicare guidelines. So you've got these symptoms, this diagnosis, this parameter, you're allowed to test this. Anything else won't be paid for.
So they did test it because we requested it.
Oh, the percent free?
Yeah, but I haven't got the results back. But they did
Oh.
do it because we said, what about this? And he was really reluctant to put that test in, but he says, for your
That's-
peace of mind, we'll do it.
Not for his, but for yours.
No, only because we brought it up and we said, what about this? We made a fuss.
But how many guys don't say anything?
They don't know it. They don't know it.
Yeah.
They don't know that this is another part of the process.
I think it's criminal. I mean,
So,
anyway, go
so
ahead.
are those tests out of date then? Is that what the thing is? Because, I mean, there's not just the vitamin D. I've heard the cholesterol test. There's 6 different cholesterols, and what they say is good, it may be not
Yeah.
so good, and what they say is bad may not be so bad.
Oh gosh, cholesterol is a whole
Yeah.
different talk. we could spend Tuesday night on that, but you're right. I mean, it's very short thinking. It's okay. PSA biopsy. PSA biopsy.
Yeah, and if there's another test, I mean,
Of course.
in between.
In fact, there's many other tests. Instead of doing just a jumping right into a biopsy, which is extremely traumatic, why not do a percent and total? Very simple. You can also watch the PSA doubling time to see, okay, how aggressive is this going on? There's also a genetic test to see what your predisposition is for your family history based on this PCA3 testing.
What does that stand for?
The PCA3? I'm sorry, I can't remember.
Because if I was to ask for that, I wouldn't even know what I'm talking about.
That might be that 3%. No, that's above that.
He'll know what you're talking about. I'm not sure he'll do it.
I know I failed because my brother has prostate.
Yeah, that could be. There's also a what's called a transrectal prostate ultrasound, which, of course, is non-invasive. Well, I guess it's a little invasive, but it doesn't puncture the prostate. So it just takes an ultrasound of it and looks at various changes in density of different tissues within the prostate. So that can give you a lot of information. Again, without, traumatizing the prostate and potentially even spreading cancer cells. Yeah.
How many PSA tests do you suggest be taken over the course before you do biopsy?
How many PSA tests do I recommend before doing a biopsy? There's too many factors involved. Some of this is the PSA doubling time, how quickly it's increasing. There's a lot of factors involved there, yeah. But biopsy is one of the last things I'll go towards. The reason it's preferred by your urologist is they want to know right away what cells we're looking at, and that's the only way to confirm it.
Well, I thought you meant cells, like how much money can we make?
Yeah. But also remember, you've got this walnut-sized gland, and they're putting like 12 little tiny needles, and a lot of times, even if you have cancer, they'll miss it. Doesn't necessarily going to hit it right on the mark. So, and here's what they ignore. Only 30% of men with a high PSA will have prostate cancer. Only 30%. So it doesn't necessarily signify that, oh, yeah, you've got it. A PSA total reading of 2.5 to 4, you've got a less than 20% risk. The normal range is anywhere from 0 to 4.0. Okay, so between 4 and 10, you've got only a 20 to 30% risk. And over 10, it gets a little more, 42 to 64%. So one thing I try to coach my male patients is, okay, how do you prepare for the test? Because there, a lot of even urologists will examine the prostate of their patient, do a whole massage of it, and then they'll go and do a PSA test. It's like you can't do it that way. It's going to raise the PSA falsely. The PSA is something that's normally produced, so yeah, it's going to aggravate that. Sexual activity or ejaculation within 48 to 72 hours can also elevate. And they've also done studies where at 1 hour after ejaculation, it raises almost a full point. So you can see how a lot of men get tested and they don't even know how to prepare for the test. They've also found that bike riding and I assume motorcycle riding. I couldn't find any research on motorcycles, but definitely bike riding within 48 hours can also elevate levels. Okay. So here's what you want to look for in the ratio of the free to total PSA. And normally this is ordered when your total PSA is over between 4 and 10. Okay. Once it gets over 10 or more, then they go right to the biopsy usually. Yeah. So you want your percent to be as high as possible. So I've had guys come in and their PSA is 8, but their percent free is like 50%. It's like really good. So we just kind of watch and wait, you know. And there's other things that cause an elevation in PSA other than prostate cancer. We already know that. Yes?
On your PSA, are there 2 readings or just one there?
Well,
You have the free and then you have the other. What is the free?
well, yeah, there's a total PSA, which is normally only ordered on its own. But then if you get a percent free PSA, it's always going to be a smaller number.
And that's a different test.
That's a different test, yeah. Yeah. So they calculate that to see what your risk is. So PSA velocity means, okay, how quickly is your PSA rising? So they like to see it, you know, less than 0.3 nanograms per mil per year, which is typical for an aging guy. You know, it's going to go up a little bit through time, but you don't want it to go up too quickly. A PSA increasing greater than 0.35 per year, they found it's not necessarily a useful indicator for prostate cancer. So a lot of docs no longer use this. Now, if it's obvious that your PSA is increasing very quickly, then they're more likely to assume the worst and just go ahead and do the biopsy. So, and there's also something called a doubling time. So this is the amount of time for your PSA to double. So it's kind of the inverse of the velocity, which going by, okay, how many months does it take to double? And this is another indication of aggressiveness of the prostate cancer. So you like to see a doubling time less than 3 months. I'm sorry, you don't want to see less than 3 months. That's extremely high risk. That's very, very quick. And over 15 months would indicate extremely low risk. But just know that the PSA is going to go up over time. It's just one of those things that happens. This is the PCA3 test. Now it's fairly definitive. That specificity is 89%. So it actually has only 11% false positives. Okay. I'm sorry, false negatives. So it's very accurate. But it also gives you the genetic material that sort of predisposes you to prostate cancer. A reading of greater than 35 is more likely prostate cancer. I don't know a lot about this test, but it's a new one we're looking into. They're researching it in England, and it's called a Engrailed 2 prostate test. And similar to the PCA3 as far as specificity and sensitivity. So I'm not sure there's a whole lot of advantage to it other than the comparing it to other readings. Does everyone know what Gleason score is? Everybody familiar with that? So when you're doing a biopsy, the pathologist will look at the cells under the microscope, and they'll classify them according to what cell types are there, how differentiated they are, or how aggressive it looks, perhaps. And the score will come in a form of like 3 plus 3, or 4 plus 4, or 3 plus 4, or something like that. And that just gives the relative aggressiveness of that cell type. Okay. So what's interesting is can I go back and forth on slides? No. Okay.
That test wouldn't indicate what type of cell is out of whack.
Yeah. So the Gleason score kind of gives the physician, how much intervention should we do here? Do we do radiation? Do we remove the prostate? Do they use castration to limit all testosterone? So then, this test I'm really excited about because we're not able to offer it here yet, but I think we're going to in the near future. It's a test that detects 26 different types of cancer. And what's really interesting about it is there's no false positives. There's only cancer cells can produce the substance that's measured, this ENOX2 protein, which is unique to malignant cells. And 26 different cancers all produce their own type of ENOX2 protein. So it's very well matched to what's going on. Expensive, I think it's about $700. So, and if you want to read about it, there's a website, OncoBlotLabs.com.
You foresee that to come down in the future the more it's used?
Yes. I really think it's going to be a really, really useful tool, mainly because of that specificity. It's so...
You know, if we could have that standardized for
Yeah.
over 50 or anybody, really.
Yeah.
High-risk categories.
Yeah. And by the way, that's one of the reasons why we don't do insurance here, because we're able to do more testing like this without getting audited and regulated and,
You should get grants then if you're doing
yeah, yeah. That's a good point, yeah. Yes?
Is that kind of similar to stuff they've been doing in certain labs over Europe for quite some time and actually detected cancers and which protocols are used best in patient?
Probably, yeah. The European research, I think, is way ahead of what we spend our money on. So, but I would say for the last 10, 20 years even, they've been studying these unique proteins that cancer cells make. And now they've got it down to a pretty good science where they can isolate it and identify it. And so yeah, it's definitely the wave. Now, so this is the ultrasound of the prostate. And we are offering this through Tahoma Clinic North Clinic. This is typically what I order as a go-between before the biopsy. So a person has a high PSA, their percent free PSA is low, their PSA velocity is questionable. So, we talk it over and decide together what we want to do. But this is a really good way of taking a picture of the prostate without, penetrating any tissue. And it's like any other ultrasound. You get variations in cell structure and parts of the prostate, so you can see what's going on. Could be just a cyst. Could be prostatitis. And we talked about 12 needle biopsies can miss affected areas, depending on the size of the prostate cancer. So the prostate biopsy, and so many patients come in and say, well, does the biopsy spread cancer? And the problem with this is nobody really knows. You know, that when you think about it, okay, they're putting these needles through the gut lining, which has tons of bacteria, right? And penetrating the prostate, pulling out, identifying a little bit of that tissue. It has been identified that breast biopsies, there are cells that are on the outside of the needle and they get released into the circulation. So I would imagine that it's also occurring, but there's no proof of that. And of course, oncologists don't worry about this because if it's negative, no big deal, right? You just might have some complications from the biopsy, maybe some bleeding for a while, some soreness. And if it's positive, then they're going to go ahead and go into their treatment cycle.
If it's negative, though, is besides the discomfort of seizure, what about what you're talking about, infection, other kinds of infection? Is there a risk for other kinds of infection from that?
Oh yeah, there is a risk of infection. I can't remember the exact rate, but it's higher than you might think. Yeah, from the E. coli and the bacteria.
Is it possible that just from that sort of infection, then even without cancer, that the prostate may eventually be removed because of that? Just from the procedure?
Rarely, I would say rarely. The complications require that prostatectomy, but yeah. So we talked about the Gleason score, and this was interesting. 83% of all biopsies are only a 3/3 Gleason score, which is pretty minimal as far as, you know, aggressiveness of the tissue. So again, prostate cancer is one of those things that is sort of much more easily managed than trying to do a lot of intervention to take care of. Only 17% are 3/4 or 4/3 or higher. So 5 + 5 is the highest grade. So are there any questions so far before we get into treatment options? Okay.
As far as prevention go, you mentioned zinc. Do you use any of the ornates? The zinc ornate, would that be more readily
Zinc orotate?
uptake?
Yeah, I like zinc picolinate, zinc orotate, really well absorbed. You always want to take zinc with food because it can upset your stomach a little bit. Yes?
You have rising PSAs and an enlarged prostate, but it doesn't come up cancerous. What's the deal if it keeps getting, if it keeps enlarging and the PSAs keep going up if you don't have cancer, what's the deal?
What do you do?
Yeah.
Let's talk about that. Yeah, that's what we're going to talk about. There are really simple, easy ways to bring that down. First of all, what can you eat? You know, let's keep it really simple. I'm going to talk about these things: pomegranate, tomato, pumpkin extract. I'm not sure how much pumpkin we eat, but brassica vegetables, fish oil.
Pumpkin seeds too?
Pumpkin seeds might be useful, but I think they're talking about a pumpkin extract. So, yeah. Oh, brassica vegetables are a certain family, like broccoli, cabbage, bok choy, Brussels sprouts. Your favorite?
It's on the next page anyways.
Yeah.
This may be a dumb question,
Prostate-specific antigen is what PSA stands for, yeah.
Say, could you use flax oil instead of the fish oil? Would that?
Yeah,
That'd be good too.
yeah. Or flaxseed meal, I think is good. So this was an interesting study. Pomegranate is really big right now for prostate. So even just 8 ounces a day can make a big difference. In this study, they found that PSA doubling time increased from a 15-month baseline to 54 months. That's like what, 3.5 times. So it's amazing how powerful that is in lengthening the PSA doubling time. They also found a 12% decrease in cell proliferation, which would have been nice to be more, but also a 17% increase in apoptosis rate, which apoptosis is the term for sort of a planned cell death that happens. So cancer cells don't know when to die. So that's why researchers look at this apoptosis rate to see what's working. Okay.
Does resveratrol affect that apoptosis rate of cancer?
I think resveratrol would be helpful here too. I didn't come across that study, but.
So in terms of, the 8 ounces of pomegranate juice is something they would suggest if you have cancer. Or
Yes.
Just have a large prostate.
So what if you just have garden variety and large prostate? It would probably help, but, and who knows what it might prevent, Because a lot of times you can get some cells in there that are thinking about going wild, and, simple things could help prevent that from taking hold. I mean, there's not a lot of research behind that part, but. How about tomatoes? We hear a lot about Lycopene, tomato products. This was a study, and I really looked for more powerful studies here, but a serving of a raw tomato daily only reduced the risk by about 3%. So, it's not that worthwhile, although men who cooked with tomato products, and unfortunately it requires high intake. So I assume that's like 5 to 7 servings a week. So you might get sick of tomatoes. Yeah. So if it was like 50%, I might say, well, yeah, that might be worth it.
Is there a problem with it being a nightshade, in the nightshade family for sensitivities and stuff?
Yeah, I always wondered that too. Tomato is a nightshade family, so could that be pro-inflammatory? That's a good question.
On the alkaline.
Oh, it's very acid.
Yeah.
It's very acid, yeah. It's actually a fruit. Yeah, it's actually a fruit. Yeah. I don't think it's acid, it's dramatically acid producing, but it's definitely got a lot of acid to it, yeah. So I'm going to look in, I discovered this product that was studied in Germany. They took over 2,200 men. They were only taking 1 to 2 caps of this pumpkin extract per day, and they got really good results. Their symptom scores dropped by 41%, and they judged their life quality improved by 46%. So they're sleeping better, they're not having to go to the bathroom as often. It's pretty significant. And the brassica vegetables, I couldn't get much data on how powerful it was, but one of the things that the broccoli and the brassicas do is really help maintain something called a 2:16 ratio, which helps men metabolize the estrogen that they're making. So the estrogen can be pretty toxic. And the brassica vegetables really help balance that out. Same with women. That 2:16 ratio can give a risk for breast cancer too. But here we're talking about risk of prostate cancer. Oh, good question. If the brassica vegetables are raw, they're much more goitrogenic. So they can inhibit your thyroid if you eat too many of it. Okay, so they're actually better cooked. They don't inhibit your thyroid as much. Or lightly steamed, so they're crunchy. So they found that fish oil with omega-3 oils, high in EPA and linolenic acid, reduced a risk of prostate cancer by 41%. So these numbers are getting better. You know, just by simple changes in your diet, you know, maybe more pumpkin pie or something.
Then you got sugar.
Without the whipped cream, right? Yeah, that's a problem. But these, you know, these things can help over time. So this is a really good movie, Danger Signal. Poor neck there, really. Ouch. Okay, so, and when I go through these studies, I try to give you the most important one first and then on down to less important. So if you only want to do one thing for your enlarged prostate, I would do the beta-sitosterol. So they did this short-term study, only 30 days. That's so short. And in 500 men, compared with placebo, they showed improved urine flow by 76%. 76%. And reduction in retained urine volume, 41%. Yeah, we have it here, yeah. The only problem was it didn't reduce the size of the prostate. So what exactly is it doing? You know, all I could figure is it must be reducing the inflammation within the prostate. So it's able to circulate more easily.
Now, you wouldn't recommend to take beta-sitosterol, or would you, as a preventative?
Yeah, if you have a family history of prostate cancer, BPH, you know, again, 60% of us are going to have this by the age of 60. Then, yeah.
So it's better to, so you don't want to leave any of that kind of stuff in reserve in case you get it. I mean, like do all the other steps first and leave that in reserve in case you do come down with it later.
Oh, I see your reasoning. So
that you don't have to.
So save your big guns for later, just in case you need it. I don't know if that's that important.
Okay.
You know, I understand cost-wise, you want to get the most bang for your buck. You know, so maybe zinc and, you know, the foods can help a lot. Keeping your hormones in balance and exercising. And yeah. I don't think you become immune to something like this.
You don't get sensitized and over.
No.
Okay.
No, these are plant sterols, so you know we're pretty much consuming them all the time.
Because I've just been heard. I don't know if I heard Dr. Wright say it too, that something that can heal can also hurt.
That's true.
So.
That's true. Whatever heals can hurt.
It's best to be tested first before you can really get into a lot of it.
Yeah. Well, sensitivity to things is a little bit different, but when you're talking herbal treatments, you know, let's say you want to go on Golden Seal forever, you know, your body's going to adapt to that. It's going to just become accustomed to getting it every day, and it's going to have less and less effect. So the herbs especially work that way. Less so, I think, for the nutritional minerals, vitamins, because our bodies make a lot of those already.
Or would you recommend any herbs on a daily basis, like malt thistle or for your liver or anything like that?
I usually don't recommend herbs on a daily basis unless, I'm recommending it for a specific issue. Well, I take that back. One herb that I really like on a daily basis might be alfalfa, because it's got so many good minerals. The roots go down, 28 feet into the ground to absorb minerals. So alfalfa tea, I think, is great. So I like beta-sitosterol. And the next one is pygeum. You probably thought I was going to go right into saw palmetto, but pygeum is really good too. It reduces nocturia, which are nighttime trips to the bathroom, by 19%, increases peak urine flow by 23%, and residual volume by 24%. So combining those first two can make a big impact in the BPH. And saw palmetto is my third one. One of the reasons you might want to do saw palmetto is because if you have a 5-alpha reductase, it really helps to lower that down. And that's why I got such a good reputation for prostate health, is because it inhibits that enzyme. And they did have one European study which compared the effectiveness of Flomax to a product called Permixin, which is an extract of saw palmetto. Over a 12-month period, and they were equal in their effects, which is pretty amazing. I find most guys come in, they're on Flomax, and and they're benefiting from it, but they can easily transition into saw palmetto. And again, we're finding these European studies that check on these interesting things that we all should be knowing about. And at the end of the study, their conclusion is, well, we need to do more research because this was such a short-term study, But it was a year. Pretty impressive. Lycopene, of course, is from the tomato extract. So rather than eating all that tomato sauce, you can go right to the lycopene. And it doesn't take a whole lot, 15 milligrams once a day for 6 months, decrease the size of the prostate by 26%. 26%. Now, with any of these products I'm talking about, it really depends on the label and where it's harvested and where it's coming from and the active ingredients. So just shop wisely. We do try to carry the best products in the dispensary, so and I brought a few up you can look at afterwards. I think we've talked enough about male pattern baldness. This was a study using both saw palmetto and beta-sitosterol twice a day. And men did notice more subjective hair quantity and hair quality scores. But if you don't have any, I'm not sure what to do with that. Save on combs. Okay, so a lot of guys will have chronic prostatitis and not realize it. Their PSA goes up, and it's one of those things that very hard to treat sometimes. And I've had men who go on antibiotics just over and over again trying to get rid of this. And it's very, very difficult. Probably the best natural product I found is oregano and something called graviola. But I did come across this one study that found the combination of saw palmetto, lycopene, and selenium help to inhibit that inflammatory reaction. So that might be worth a try. I haven't tried that in my practice.
Raviola's anti-cancer.
Yes.
herb too.
Yeah. Another product that helps is bioflavonoids, especially quercetin. And it definitely helps with chronic pelvic pain for men. 82% of men taking quercetin had at least a 25% improvement, while only 20% of those taking placebo had the same effect. So that's still not getting to the real problem, but and I've never used ryegrass pollen either, but I came across these really interesting studies. Again, more European studies. Prostatidynia is just sort of prostate pain, so, or discomfort. Now, one theory behind chronic prostatitis is that there's something called nanobacteria within the prostate. And nanobacteria are really, really tiny bacteria, about the size of 1,000th of a regular bacteria. And I'm starting to try some of these products from Nanobiotech Pharma. So these are things that you can actually order on your own if you like to try if you're suffering from that. Prostatitis is one of those things that I always recommend more ejaculations just to help keep things moving, and that's the best way to deal with that. So let's talk about prostate cancer. Second most frequent cause of cancer death in men. 1 in 6 will get prostate cancer, but only 15% are the aggressive cell types. In 2010, over 217,000 were diagnosed. This is really interesting. So this is why prostate cancer is easily managed over time, or more easily managed. You know, when you're talking about pancreatic cancer, kidney cancer, stomach cancer, the life expectancy is under a year. So they're very, very aggressive. They need, you know, aggressive therapy. Lung cancer is about a year. Colon's about 2 years. You know, breast is 3. Prostate is 13 years from doing nothing. So you really have time to kind of watch and wait and work with simple things, work with natural therapies. So what are the best treatments for prostate cancer? These are quotes from Dr. Tambouri, who is probably the most famous natural, he's a naturopathic physician, but he strictly does men's health and prostate health, and he's sort of a naturopathic urologist. He has a practice in Phoenix. But he comes up every so often to do the prostate ultrasounds at our North Clinic. And these are some of his views. He finds that 80% of prostatectomies are unnecessary. 80%. And of course, the previous gold standard for prostate cancer was just removing it. And that still happens quite a bit. But the new gold standard is now active surveillance, or just watching and waiting and tracking it, you know, using these other simple things. Especially if the PSA is under 15. You can manage that fairly easily. And we talked about other anti-inflammatories, curcumin, fish oil, flax seeds. Melatonin is showing really good success at treating prostate cancer. Of course, you want to take it before bed because you've got a pretty high dose here. It'll knock you out. You'll sleep really well. A lot of people complain of grogginess in the morning at that big a dose. But years ago, they did a research study where they measured the amount of melatonin for autopsies for people that died from all causes. And the people that had the highest melatonin had the least cancer, all kinds of different cancers. So it turns out melatonin is useful for a lot of different cancers.
Does that have anything to do with just proper sleep too? Or did they do a blind on just people who sleep good?
Yeah, maybe it just helped their sleep enough to help them heal themselves, yeah. So this was a study with 14 advanced patients that they had sort of given up on. And they gave them 20 milligrams of melatonin. 50% of them had a 50% reduction in PSA. At least a 50% reduction. That's pretty dramatic. So that's my number one. Number two would be selenium. And selenium has a lot of anti-cancer research behind it. They found that low plasma selenium is associated with a 4 to 5-fold increased risk of prostate cancer. So they measure these things, and then they ask people years down the road if they've had prostate cancer, and that's how they correlate that. So because selenium decreases with age, along with other minerals, older men can particularly benefit from selenium supplement. I think we're almost done here. Lycopene, 4 milligrams twice a day, can prevent prostate enlargement from turning into prostate cancer. And there seems to be an inverse relationship between lycopene and PSA levels. Here's the study on Kegels, which are the pelvic exercises. By the way, if you want to just put the title of these research articles into Google, you usually can get them right up and read them, if you want to read the abstracts at least. Does everybody understand how to do a Kegel? So it's when next time you're shutting off urination, think about the muscles you're using, okay? So that's the squeezing you're doing, which pretty much kind of squeezes your bladder up and helps remove any residual volume. And I tell people to practice that squeezing at red lights. So, I mean, we're not doing anything, right? Nobody can see what you're doing. That's right. Only a green light will do that. But I usually recommend like 50, 2 or 3 times a day. So you're doing this quite a bit to build up that muscle. It's like any other muscle. You want to really exercise it.
I don't know if anybody's tried that. For me, that worked really good.
Yeah.
It's like my prostate is doing push-ups on my bladder.
I love it. There you go. He said, he said it was like his prostate was doing push-ups on his bladder. Good, we got that on tape. And, you know, these guys that ride their motorcycles cross-country, I mean, their prostate really suffers, you know, it really suffers. You get that vibration, and there's no muscle movement on their butt. They're just kind of sitting there for miles and miles. I think it's a big problem. Dr. Tambouri told me about this too. He feels like it's a big problem. They've done more studies on bike riding, though. So they found that men, after cycling, their PSAs went up almost 10%. You know, and especially in those really small bike seats, you know, your prostate is really compressed on that. So it's really irritating. And you're bent over, putting more pressure on them. Yeah.
So you recommend a walnut cracker.
Yeah, a walnut cracker. Thank you.
You recommend the elliptical machine over the bike, the stationary bike.
An elliptical machine would be better, you know, rebounding. I mean, I'm not down on cycling. I really enjoy cycling, but
Even with a bigger seat, I mean, you can have
a bigger seat is better. So if you can get a seat where those two bones in back are sitting, supporting you, you know, then that takes the pressure off. So tractor seat, yeah. There you go. Yeah, you don't need to make speed records here. We can just be comfortable.
So you mentioned vagal exercises. So things like, you know, your musculature, like psoas, iliopsoas, involved in this, is that something people, not for cancer, but for
Incontinence or
just the world, you know, I mean, all the inflammatory issues that occur.
well, I always encourage people to exercise their whole body, you know. So stretching, yoga is going to help that. I don't know if those particular muscles are involved with the prostate, just because, yeah, they're surrounding it. And of course, if you're supporting the other organs around it, you're going to be helping the prostate.
I ask you where you stand on ozonated water?
Oh, I'd rather not talk about that tonight. It's a big topic, but I can talk to you afterwards about that. Yeah.
My doctor told me that I had started hemorrhoids.
Yes.
I started doing my Kegels.
There you go.
Whatever that was.
Hemorrhoids and incontinence. You know, women that have had large babies, that pelvic floor just gets really stretched out. So by doing that exercise, it really lifts things up. They don't get incontinent. It really helps.
Does it improve your sight?
That's the opposite of going blind.
We're going to have you do a Tuesday talk up here pretty soon.
He's got the Kegels going.
Oh, wow. Yes.
Are you saying that 9.5% increase in PSA from bike riding, that's permanent?
No, I'm sorry, that's not a permanent
Only on that one
increase.
session we took.
Yeah, so the men would ride their bike, you know, I'm not sure how many miles or how long it was, but then they checked their PSA right afterwards and it had jumped up. Yeah. But over time, you know, it's got to be inflaming the prostate. So remember that semen contains 500 to 1,000 times serum levels of zinc, so zinc is a really important mineral. Among men with a normal PSA, there's a significant reduction in the rate of progression into prostate cancer for men taking even small amounts of zinc. This was a study over 8 years taking just small amounts of C, E, and zinc. And, you know, we're reminded here again that a lot of these nutrients are, what's the word? They work together in ways that we're not, synergistic, thank you. It works in ways that we're not aware of. So that's why we need a little bit of just all these nutrients to help us. We don't need big amounts, but
Do you have a supplement here that's a combination like that?
yes. In fact, I think the best thing is Dr. Wright's formula.
Is it
Um,
zinc, picolinate, or ornate? And I was wondering about the type of vitamin C and the type of vitamin D that would matter too.
Well, I would think the gamma tocopherol vitamin E would be the best.
Okay.
I brought up some products from the dispensary for anyone to look at.
Are there foods that have a combination similar to that? Zinc, C, and E?
Oh, that's a good question. Zinc, I mean, orange juice has definitely that amount of vitamin C. I can't think of anything offhand that has all those things.
Zinc in any particular food over others?
Well, seafood, yeah. Oysters, if you like them.
Is that okay with Fukushima now?
Oh, yeah. The whole Fukushima issue is really a hot topic. So this is the synopsis of the talk here. And I tried to, again, put them in order of importance. So these are the most important prostate supplements. And most of these things are in Dr. Wright's formula, so I'm happy with that. And it works, you know. It helps with prostate enlargement. Everybody got a copy of the slides, I hope? So.
It says fish oil high in, it's high, I can't remember, it's high in some EPA.
Yes. Oh, I can't remember exactly. But yeah, it's true. Men need more EPA than DHA, and women do better with more DHA than EPA. So just in general. Growing old is not for sissies.